Age Guide Northeastern Illinois is part of the State Health Insurance Assistance Program, or SHIP, that offers free, unbiased counseling for Medicare and Medicaid beneficiaries. Age Guide and its partner agencies have SHIP counselors ready to help you navigate these complex programs and ensure that you and your loved ones have the health coverage that works best. Now, let's focus on what you can do and should know when you're new to Medicare. When you are new to Medicare, it can be difficult to know where you need to start, or you may be unsure of what questions you should be asking. Lots of information and resources will be made available to you, but it can be overwhelming. Your Medicare enrollment process can be different depending on several factors, so it's good to have an idea of what to expect. A good place to start is knowing how you enroll in Medicare. As you may already know, most people are eligible for Medicare when you turn 65. Individuals under the age of 65 and who qualify as disabled can also enroll in Medicare. Usually, you are automatically enrolled in Medicare Part A and Part B, but you may have to take action to enroll. Enrollment in Medicare is administered by Social Security. Social Security recommends that you apply for Medicare on the Social Security website, but you can fill out a paper form and take them to the Social Security office. If you've elected to receive Social Security benefits at 65, you will automatically be enrolled in Medicare. If you're not going to receive Social Security benefits at 65, you will have to enroll in Medicare. We will review some situations where enrollment isn't automatic and the choices you will have. The Medicare website, medicare.gov, is where you can compare and shop for Medicare prescription drug plans. Medicare.gov will allow you to compare every plan that's available to you, and you can sign up directly from the Medicare site. You can also compare and enroll in a Medicare Advantage plan on Medicare.gov. To enroll in a Medigap plan, you can call the insurance company directly to sign up. If you have health coverage through your employer, you can keep it and enroll in Medicare. The same rules apply if your health coverage is through your spouse's employer. You may only need to enroll in Medicare Part A because you have coverage through your employer or spouse, and Part A is free for most people. Some employers may require that you enroll in Part A even when you're covered by their plan. You can defer enrollment in Medicare Part B if your employer has 20 or more employees and you are enrolled in the employer-provided group health plan. If you are eligible to defer enrollment in Part B, you can avoid paying extra for coverage and you won't be penalized as long as you're covered by the employer plan. In most cases, your employer group health plan will be the primary insurance and Medicare secondary. If your employer has less than 20 employees, Medicare would be your primary insurance. When you decide to not enroll in Part B, you can be penalized by paying extra when you do decide to sign up. If you are not eligible to defer enrollment in Part B and you decide to not enroll, you will be penalized 10% for each 12-month period that goes by before you do sign up for Part B. You would have to pay this penalty for the rest of your life. You can also be liable for a Part D penalty if you don't sign up when you're supposed to. The Part D penalty is different from Part B in that you are penalized 1% for each month that you are not covered by a drug plan. This penalty will also carry with you as long as you have a Part D plan. Low-income individuals can qualify for a benefit that exempts you from these penalties. You will hear more about this benefit later. Your initial enrollment period is when you can start to plan out and sign up for your Medicare coverage. You have a total of 7 months to set up your Medicare benefits. The initial enrollment period begins 3 months before the month of your birthday, includes the month of your birthday, and continues for 3 more months after your birth month. For most people, your Medicare Part A and Part B coverage will start the first day of the month of your birthday. If your birthday falls on the first day of the month, your coverage will begin the month before you turn 65. When you enroll in coverage before the month of your birthday, your coverage will start the month your Medicare benefits start. If you enroll in a plan on the month of your birthday or after, coverage will start in the following month. Every year, the Medicare open enrollment period starts on October 15th and ends on December 7th. During this time, you can change your Part D prescription drug plan or enroll in or drop your Medicare Advantage plan. Changes to your Medicare coverage during the open enrollment period will take effect on January 1st. If you're already enrolled in a Medicare Advantage plan, you are also allowed to make changes during the Medicare Advantage open enrollment, which takes place from January 1st to March 31st. You are able to change to a different Medicare Advantage plan or drop your Advantage plan and switch to Original Medicare. Changes to your coverage will take effect the following month. Certain life-changing circumstances can mean you qualify for a special enrollment period that allows you to enroll in or make changes to your health coverage. If you qualify for a special enrollment period, you do not have to wait for the Medicare open enrollment period to update your coverage. A few examples of circumstances that qualify you for a special enrollment period includes loss of other health coverage, moving outside of your coverage area, or becoming eligible for Medicaid. When you lose coverage or move outside of your coverage area, you will have 2 full months to enroll in a new plan. If eligible for Medicaid, you can also change your coverage 3 times every 3 months starting in January. There are several other cases where you are eligible for a special enrollment period, so feel free to contact a SHIP counselor when your health coverage is changing. If you started with Medicaid and are now eligible for Medicare, you can have both. Medicare will be your primary insurance and Medicaid secondary. Medicaid will continue to cover you as long as it is a service that is covered by Medicaid. Having both Medicare and Medicaid will make it so that you have zero or very low out-of-pocket costs for health care. Qualifying for Medicaid entitles you to other benefits that help you save on Medicare costs. The Extra Help Low Income Subsidy Program gives you a discount on Part D prescription drug plan premiums and copays. You will qualify for plans that have a $0 monthly premium, and the cost of your prescriptions will be capped. Extra Help requires that you meet income and asset limits to qualify, but you automatically qualify for Extra Help when you qualify for Medicaid. Medicare savings programs help pay for the Medicare Part B monthly premium, and it can also pay for deductibles and copays. Even if you already qualify for Medicaid, you must fill out an application to apply for this benefit. A SHIP counselor can help you apply. Here at Age Guide, we have Senior Health Insurance Program Counselors, or SHIP counselors, who can help you navigate your health insurance options through Medicare and help you find ways to save on Medicare costs. The Senior Health Insurance Program is a free statewide health insurance counseling service for Medicare beneficiaries and their caregivers. You can contact Age Guide at 800-528-2000 to speak with a SHIP counselor or contact one of our Aging and Disability Resource Network partners for local assistance.